Hello, and thank you for joining us today. My name is Elena Wiesner, and I am the Director of Marketing and Business Development for McLaren Bay Region. Today, we have with us Danielle Jean, RN. She's a nursing manager at McLaren Bay Region's Emergency Department here at the main campus in Bay City. Thank you for joining us, Danielle.
Hi, Elena. Thank you for having me. My name is Danielle Jean. I am the nursing manager here at McLaren Bay Region. And today I'm going to give a little presentation on cardiovascular disease and heart attacks and what you should expect should you find yourself experiencing one. Cardiovascular disease relates to the vascular system of your body, mainly your heart. Cardio is the heart. Vascular is referring to the vessels and arteries that run throughout your body, and they supply oxygen to all of your organs. Cardiovascular disease is when there is damage to those vessels and arteries, and it is the number one cause of death in the United States today. Coronary artery disease is the more common form of cardiovascular disease, and that is specific to the heart itself. The two most common causes for coronary artery disease are a buildup of plaque and inflammation of the arterial walls. Plaque is a sticky buildup of fatty deposits that collect inside the arteries. Both of them cause narrowing of the arteries, which decreases blood flow to the heart. And I have a visual in the picture here on the slide. It shows how it develops over time. It is usually not sudden. It is something that develops over several years and becomes a factor later in life. So what is a heart attack? Heart attack is known as an acute myocardial infarction. When we say acute myocardial infarction, myo and cardial refers to the heart muscle, and infarction is death. So a heart attack is essentially death of cardiac muscle. And that occurs when there is a sudden or complete blockage of one of the four coronary arteries that supplies blood to an area of the heart. In some rare cases, more than one artery may be blocked at the same time. Without immediate intervention, permanent damage and or death can occur. So what are the causes of a heart attack? There's many causes of heart attacks. Like I stated previously, plaque buildup and inflammation of the arteries are the two most common. And how that works is plaque builds up over time and eventually it will break apart inside the artery. Where that break occurs, the stickiness of the plaque causes other blood cells to stick to it, and it will continue to build until it is large enough that it occludes blood flow from that artery. And the part of the heart that is supplied by that artery will suffer permanent damage or die. Essentially, you'll have a heart attack. There are other less common causes of heart attacks, some rare medical conditions such as congenital heart defects. Blunt force trauma to the chest can cause a cardiac tamponade. Cardiac tamponade is when there's a fluid buildup around the heart and it causes an increased pressure and doesn't allow it to pump effectively. Pulmonary embolism is known as a PE, or a blood clot in the lung. And electrolyte imbalances such as too much or too little potassium can be detrimental and cause life-threatening arrhythmias and lead to heart attacks. So signs and symptoms. Signs and symptoms for heart attacks can be common, they can be vague, but there are classic chest pain and shortness of breath. Those are your two most common, and sometimes they conclude together and sometimes it's one or the other. Palpitations, fluttering in your chest, or like a fullness feeling in your throat is also very common. Some people will complain of feeling lightheaded or dizzy. Some just feel very tired or fatigued, like they just don't have the energy. Syncope or passing out is a big sign. Some people just feel an increased level of anxiety, or they have that feeling of impending doom. When you see it as a healthcare provider, it's like that deer in the headlight look, that they know something's wrong, but they just can't put their finger on it. All of these signs and symptoms are taken very seriously by everybody, and we try to treat them as quickly as we can. Another important factor with chest pain and a lot of these symptoms is everybody has a different perception of pain and discomfort. Some will describe the pain as a sharp or stab-like pain in the chest. They might have a dull ache feeling, and some even describe it as a chest pressure or a heaviness, and they just can't put their finger on what is going on. Everybody is at risk for having a heart attack, and yes, there is a difference between the signs and symptoms for men versus women. Men tend to present with the more classic signs or symptoms such as chest pain and shortness of breath. Women, like most things, we tend to be a little more difficult. We like to present with vague symptoms like I just don't feel well, or I just feel sick to my stomach, like I could throw up. I have an indigestion, or it's just heartburn. They just can't quite put their finger on it. Sometimes they'll have a cold sweat, but it's not always the classic chest pain or shortness of breath. Another common concern with cardiac is females who complain of abdominal pain or epigastric pain. You will commonly find emergency departments will still do a complete cardiac workup because of their higher risk and vague complaint for cardiac symptoms. So, what are the risks? There's two different categories of risk for cardiovascular disease and heart attacks: non-modifiable and modifiable. Non-modifiable risk factors are things that you have no control over, things that you can't change. These are like your age, your sex, family history, genetics, your ethnicity. You can't change those. However, there are ways that you can manage them, such with lifestyle changes and or medications. Modifiable risk factors are things that you can change. Smoking, alcohol consumption, cholesterol levels, your blood pressure, having obesity. All of these are things that you as a person can change on your own. You can quit smoking, you can decrease your alcohol consumption, you can control cholesterol and blood pressure with medications, and obesity you can control with a lifestyle change, such as healthier diet, cutting out salts, fats, and sugars, and trying to include some more vegetables, fruits, and eating more lean meats. Even just simple things like walking 30 minutes a day, increasing your physical activity, can have a huge impact on obesity, hypertension, cholesterol, even diabetes themselves, and help lower your risk for having a heart attack. So how do we know it's a heart attack? There's a series of tests that we do when you come into the emergency department, and all of them help us paint a big picture as to what's going on. First things we're going to do is we're going to take your vital signs. That's going to be your blood pressure. We're going to take your heart rate, check your oxygen levels. We're going to do an EKG, which is an electrocardiogram. I have pictured here on this slide. We're going to do some lab tests or blood work, and we're specifically going to look at your cardiac enzymes. Chest x-ray is also something we're going to do as the workup, and that lets us actually look at your heart to see if there's any obvious abnormalities. The electrocardiogram, what that is basically an electrical printout of the activity in your heart. It is presented in the form of lines and segments, as you can see pictured here, and there is a normal range for each line and segment, and then anything that is outside of that range points to a specific part of the heart. That is how we can determine that there's injury occurring and where it is occurring at. The lab work that we're going to do is specific to the cardiac enzymes. What we look for there is an elevation. Sometimes you can have chest pain. We'll do an EKG and it could be perfectly normal. We like to do blood work as well because elevations in that troponin levels or the cardiac enzymes can indicate that there is some sort of injury happening with your heart and you are at a high risk for having a heart attack in the near future. And we like to be thorough with our assessment. Treatment for heart attack. It's a very quick process. Vital signs are going to be taken very frequently. When you come to the emergency department, you are going to have a whole lot of people coming at you all at the same time, and you can have up to 5 to 7 team members all doing something together. IVs, we're going to put 2 IVs in, most likely 1 in each arm, and that's that we have access for IV fluids or if we need to give you any medications. We're going to put you on our heart monitor, which is the sticky electrodes with the wires attached to it. And what that does is that gives us a continuous monitoring of your EKG rhythm, and it lets us monitor for any changes. The defibrillator pads, those are commonly known. For back in the day, they used to be the hard paddles that you would see them use on the chest to shock somebody. Those are placed on your chest for the need that if the heart attack is so severe, it causes your heart to stop or go into a lethal rhythm that we can shock it back to normal rhythm. We're also going to prep you for a cardiac catheterization by shaving both of your wrists and groin areas. Reason being is those are the 2 main sites for a cardiac cath, and they like to be prepared as soon as we get you to the cath lab. That way there's no delays in getting you intervention. MONA is the acronym used commonly throughout healthcare, and that stands for morphine, oxygen, nitroglycerin, and aspirin. Morphine is more commonly known as a pain medication. The reason it's given for cardiac pain is because it helps decrease your heart rate, it helps decrease your blood pressure, and can help decrease the venous return to the heart. Essentially, your heart does not have to work as hard during its time of injury. Oxygen, it's not given to treat any symptoms. However, it does help improve oxygenation to the damaged tissue of the heart. Nitroglycerin is known as a vasodilator. And what that means is it dilates the vessels. It opens them up to improve blood flow to the area of the heart that's being affected. Aspirin, also not given for pain or discomfort, it is an antiplatelet. It is preventing any worsening clotting factors in the bloodstream. So now you find yourself having a heart attack or having symptoms of a heart attack. What are you going to expect when you arrive to the hospital? There's two ways you can arrive to the hospital, either by private vehicle or by ambulance. First thing's going to happen if you drive yourself, you're going to go up to the front desk and register for chest pain. That registration clerk is going to call our triage nurse, who is responsible for the front door people and everybody in the waiting room, and they're going to notify them that you're having chest pain. That nurse is then going to bring you back into one of our EKG rooms and get your EKG done as soon as possible. We have a standard goal to have that EKG completed in 10 minutes or less from your time of arrival. If your EKG does show that you're having a heart attack, that nurse is going to immediately notify the emergency room physician, and they are going to activate a code Dr. Heart. What this is, it's an overhead page. If you've been in the hospital, you may have heard codes Dr. Heart overhead. And what that does is it alerts the cardiologist and the cath lab team of your emergent condition, and they will begin to prepare to conduct immediate intervention on you. So a lot of times people aren't sure, do I call 911 or do I drive myself? The answer is always yes. Call 911, take that ambulance ride to the hospital. Reason being is time is tissue. Early identification of a heart attack could really be the difference between life or death for that situation. Paramedics are medical professionals. They perform and interpret EKGs, they can start IVs, and they give medications just like nurses and doctors do in the emergency department. They initiate your care right on scene. They'll notify the ER of any abnormal findings, either before or during their transport, and that gives the ER team more time to prepare for your emergent arrival. This is something that I can attest to personally myself. Before I became a registered nurse 4 years ago in the emergency department, I worked on the ambulance for 10 years. I started as an EMT and graduated up to the paramedic level. And there is a lot that the general public doesn't understand about the ambulance crews is we are medical professionals, and there are things that we can do other than just transport you to the hospital. They can give you those medications I talked about. They can start those IVs. They can get that early identification of a heart attack. And they call us. They could be on scene doing their assessment, put the EKG on you while you're still at home sitting in your recliner or sitting on the couch. And they're going to make that phone call to the ER saying, I have somebody having a heart attack. And what we're going to do on our end is we're going to activate that code Dr. Heart. So, and the reason we do that is because the sooner we activate the cath lab team and the cardiologist, the sooner you get up to the cath lab and have the intervention to fix the problem. Give the nurses, give the doctors, and give the paramedics a chance to save your life, and give yourself every chance to survive should you experience a heart attack. Thank you.
All right, that is some great information, Danielle. We have a number of questions that have come in that our community would love to see answered. The first one comes from Janelle. Are anxiety attacks often mistaken for heart attacks by patients? If so, is there a major symptom to watch for to know the difference?
That's a very good question, actually. A lot of people come in experiencing anxiety attacks, and they don't realize that it's an anxiety attack. If you present to the ER with increased anxiousness, you're having chest pain, you feel like your chest is just crushing pressure, we're still going to do that EKG. We're still going to do the lab work that we would to rule out a heart attack, because it's easier to treat for the worst and hope for the best. So if you do come in with anxiety, we are going to rule out the most life-threatening as a heart attack, and we will go from there with your care. Great
And I think
question.
it's really important to mention that you should never feel embarrassed if it was a false alarm, if it was just anxiety. I think that when I was going into labor, I had to go in once because it was a false alarm and I was so embarrassed. And they're like, no, we'd rather it be you be here. So,
Better to
okay,
be
we have,
safe.
yes. So, okay, we have another question from Sharon. And I have this question too, because I live like 2 minutes from the hospital. So,
Mhm.
she said, I don't live very far from the hospital. How far is too far to drive for myself?
Well, that's a very good question. And what I will touch with that is simply the safety of driving yourself during a medical emergency. So you put yourself, you're having chest pain, you're having discomfort. Now just picture yourself driving to the hospital. So not only are you experiencing a medical emergency yourself, you're putting others at risk for an emergency. There's no reason or no way to tell how severe your heart attack is until we know that it's in fact a heart attack and what site of the heart it's affecting. If you're driving and it progresses and it can change any second to very severe or life-threatening, you go unresponsible while you're driving, now you've created an emergency for somebody else. That's why we always say it's better to dial 911, get that ambulance right there versus taking the risk of driving yourself.
Okay, no, that's great advice. So don't try to be a hero and drive yourself. So, okay, we have another question from Chris. Does pancreatitis have similar symptoms to heart attack symptoms?
Yes, actually, they do. They can mimic the same signs and symptoms. And a lot of time in the hospital, when you're coming with abdominal related pain or chest pain, we generally will run the same workup because the cardiac workup itself will cover all of the basic labs that we're going to do, including your electrolyte levels. But we just add in that cardiac enzyme, which is known as the troponin level. So that's a very good question. They do present the same, and we will do the more advanced or the more thorough workup to rule out all possible causes. Great question.
Gotcha. And
Yeah.
regardless, if you're experiencing those symptoms, come in. So even if it is not a heart attack. So,
Mhm.
okay, we have, I think one last oh, we got two questions from Amy. The first one is, if someone has regular arrhythmia, how can you tell if it's a heart attack?
Oh, that's a great question. There are a lot of different arrhythmias out there. Some people live with every day. Mainly, those are your lower risk arrhythmias, which are common. How we can tell if it's a heart attack or not is based on the layout and measurements of the lines and segments presented on the EKG. If you recall from the slides I showed earlier, there was one that was a normal EKG, which are your basic measurements for those lines and segments. And the one next to it, you could see the obvious difference. One was very high and wide, and it was grossly abnormal. And what that does is we measure those and looking at them, it'll tell us what part of the heart is affected.
Great. Okay. So Amy's second question is chest pain when you're experiencing a heart attack primarily on left side of your chest, the right side? Is it doesn't necessarily follow a rhyme or reason?
That's a good question. In the past, they would always say the classic presentation, left-sided chest pain, and it sometimes will radiate to your shoulder and to your jaw. That's not really the case anymore. You can have chest pain in the center of your chest. You can have it right-sided, left-sided. Some people don't even experience chest pain at all. They might just have a ache in their left or right shoulder or a back ache, pain radiating down their arm with no known injury. Chest pain is what used to be known as the classic symptom is not always the case. You can have a heart attack and not have any chest pain at all. That's why we say if you're experiencing any of these symptoms, it's better to get checked out to rule out the worst case scenario than take that risk and stay home. Great question.
All right, great. Well, we will have this available on Facebook for people to watch if they come on late or if they think of a question. Feel free to leave it in the comment section and we'll make sure that Danielle gets this. Danielle, we cannot thank you enough for your time today. This is really, really important information, and American Heart Month is just a great excuse to get it out there. So
Yeah. Thank you
thank
very
you,
much for having
Danielle.
me today. I appreciate it. Thank you.
Yeah. Okay. And then we have another upcoming Facebook Live event. It will be on February 24th at 5:30, and it will be Dr. Candace Colby Scott, an ENT at McLaren, who will be discussing migraines, dizziness, and vertigo. So again, please make sure to tune in and be ready with your questions, and Dr. Colby Scott will be happy to answer them for you. Thank you so much, and have a wonderful day.